Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, digital flashcards, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 40-year-old woman with bipolar disorder is prescribed lithium to help manage her mood swings. At her follow up visit, she reports feeling increasingly thirsty, needing to urinate more frequently, and experiencing mild tremors. As a nurse practitioner, what is the most important initial step in her care? Is it A, suggest an increase in fluid intake to manage thirst and urination? B, recommend a change in her bipolar medication to avoid side effects? C, check her serum lithium levels to assess for toxicity? Or D, advise her to stop the medication and seek immediate psychiatric care? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, as a nurse practitioner, what is the most important initial step in her care? So, all right, so we're looking for some prioritization in care. So let's see what's even going on. So we have this 40-year-old female with bipolar disorder. She's on lithium, and this is a follow-up appointment, but she is reporting having increased thirst, increased urination, and mild tremors. So you want to make sure you're checking her serum lithium levels to make sure there's not lithium toxicity. Okay, and that is key. I know we discussed on yesterday also checking, the kidney function, the thyroid function, because lithium can cause alterations in those lab values, but we always check a serum lithium level to make sure there's no lithium toxicity, okay? Question number two. A 28-year-old man has been on lithium for bipolar disorder for several months. At his routine follow-up, he reports no new symptoms, but his physical exam reveals a mild weight gain and slight ankle edema. As his nurse practitioner, what lab work should be prioritized during this visit to monitor the effects of lithium? Is it A, CBC and thyroid function test, B, a liver function test and lipid panel, C, serum lithium levels and renal function tests, the creatinine and BUN, or D, fasting glucose and hemoglobin A1C? What do you think? Tell me in the comments. All right, so here the stem of the question states, as his nurse practitioner, what lab work should be prioritized during his visit to monitor the effects of the lithium? All right, so this patient has been on lithium for several months, but his new symptoms on exam is weight gain and ankle edema. So you want to check those serum lithium levels, but also you want to make sure to assess the renal function, okay? C. All right. And then lastly, question number three. A 33-year-old woman is starting lithium treatment for bipolar disorder. As her nurse practitioner, you discuss potential side effects and emphasize the importance of monitoring during her treatment. Which of the following instructions should you prioritize when educating her about the use of lithium? Is it A, lithium should be taken on an empty stomach for better absorption? B, she should avoid sudden changes in salt intake and drink plenty of fluids. C, it is important to take lithium only during episodes of mania for effectiveness. Or D, lithium therapy should be discontinued if weight gain occurs. Take a moment and tell me what you got, you guys. All right, so stem of the question here states, which of the following instructions should you prioritize when educating her about the use of lithium? And your best answer is B. You want to make sure you tell your patients to avoid sudden changes in salt intake and drink plenty of fluids. Now, this is some things that I find that, isn't mentioned a lot, but one of those key things to be sure of is you don't want to do drastic changes in sodium intake, meaning you don't want to be on a drastic low sodium diet suddenly. and you don't want to start increasing your sodium suddenly. You don't want to be dehydrated because the balance of sodium in your body affects the lithium levels. So when you have these drastic changes in sodium levels, you will also start to see excess in lithium levels, and can lead to lithium toxicity. So it's big to make sure you're educating your patient on their sodium intake when they're taking lithium. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one, at gmail.com. All of the things that I do offer are linked in the bio of this channel, including my website. But if you're looking to book any one-on-one sessions or any other personalized or customized plans, feel free to either call, text, or email so that I can speak with you guys, because I prefer to discuss what your needs are so that we can gauge what you really need to make sure you're booking the appropriate session type. All right, you guys, as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.